Okay, thank you. Good afternoon, everyone. I'd like to welcome you to this month's meeting of the System of Care Expansion Leadership Learning Community. I'm Beth Stroll with the Technical Assistance Network, TA Network for Children's Behavioral Health. And we will be talking today about social marketing and strategic communications. First, let me take a moment to tell you about the System of Care Expansion Leadership Learning Community if you haven't joined us previously. We have a monthly learning community, and we want to support you as System of Care leaders, principal investigators, project directors, leaders in various content areas, and any other people within your grantee and other states and communities working on System of Care expansion. And we try to address topics of importance to you and that you are facing as part of your grant requirements and also as part of your initiatives to expand systems of care widely throughout your states and communities. We really like to make these learning community meetings interactive, so we encourage you to use the chat box throughout, and we will be monitoring that, responding in real time, and also making sure that when an appropriate time arises, the presenters will also be answering the questions and the comments that you put in the chat box. As I mentioned, today we'll be focusing on social marketing and strategic communication, and we really have a dual goal to focus on the communication plan that you'll be working on, but also to really take advantage strategically of Children's Mental Health Awareness Day will be coming up in May, and how that can be used in many different ways to support your communication and social marketing goals. If you'll notice on the right side of your screen at the bottom, there are quite a few slides that you will be able to download that are materials provided by our presenters and the social marketing technical assistance team that can help you with your planning process and with Children's Mental Health Awareness Day. So you can download those during the presentation, but also following the webinar, they will also be available for at least 10 minutes for you to download then if you prefer not to do it during the webinar itself. So please do put your comments and put your questions in the chat box. We want this, again, to be interactive, and we want to be responsive to your questions and to your needs. I also would like to mention before we get started that next month's topic will be on family youth engagement and leadership. The learning community will be on February 15th. We have some wonderful presenters lined up for you from FREDLA and Youth Move, and we'll be helping you to understand some of the effective strategies that have been used and can be used for engaging youth and families in your expansion work, and also for nurturing leadership among family members and youth. I'd like to take a moment also to introduce the presenters on today's webinar and our meeting. First, we'll have Lisa Rubenstein. She is a public health advisor at the Center for Mental Health Services in SAMHSA, and she's the government project officer for the Caring for Every Child's Mental Health campaign that is sponsored by SAMHSA. We also have Tina Worrell. Tina is the communications coordinator for one of the System of Care expansion sites in Kent County, Michigan. And then we also have Kristen Melton and Shannon Walsh, both of whom are technical assistance providers that are part of the Caring for Every Child's Mental Health campaign, and they are part of the social marketing TA team that is assigned to work with grantees to help you with your social marketing planning and activities and with Awareness Day. The learning objectives for today's webinar are, first of all, as I alluded to really learn how social marketing and communications can support your goals around expansion and sustainability for systems of care, and to learn more about the social marketing planning process that will help you to accomplish and meet the requirement of your grant to create a social marketing communications plan by the end of year one. And then leveraging Awareness Day as a social marketing tool, what the plans are for Awareness Day at the national level, how to connect to the national event, and also how to think about how you can use Awareness Day locally in your states and communities as well, and tie that into your social marketing and communication objectives. I will now turn this over to Lisa Rubenstein. And Lisa, take it away.
Thank you, Beth. And good afternoon, everyone. I'd like to start with a really brief poll to get a sense from you where you're at in your planning with National Children's Mental Health Awareness Day. There's no right or wrong answers, just a way to get you start thinking about where you are in the process. 1 is still thinking about it. 2 is we've got the ball rolling. And 3 is we're ready to go. Be real surprised if many folks are ready to go. I know we're not yet, but again, we're just interested in seeing where you think you are in the process. But for the majority of us, we're still thinking about it, which, given it's January, that's a really good place to be. So that's great to start thinking about. No matter where you are in this process, we're here to help you. There's a wonderful technical assistance team as well as your government project officers who are always here to support you in your Awareness Day planning and in all of your social marketing activities. Next slide, please. So what is social marketing? Some folks kind of mix it up with social media, which is very different. Social media is one platform that can be used for social marketing, or a set of platforms. Social marketing is actually a scientific discipline that's based on adapting commercial marketing principles to improve social good, to really address social good. So it looks at physical, social, and economic environment, and it helps us to impact the behavior of communities, states, tribes, individuals. Next slide, please. Now, in the RFP or the FOA, whichever year you've been funded, the request for application or the funding opportunity application, there are 3 requirements addressing social marketing specifically. And the reason we have these requirements is that we have seen over the years, some years when these requirements were included and some weren't, that there's a huge difference in the ability for the grantees to have effective social marketing communications efforts. The first one is hiring a half-time social marketer. This could be a member of the system of care, or some grantee sites choose to use a contractor. However, if you use an outside contractor, we really encourage you to involve that outside contractor in all the elements of system of care so that that person or that group is really understanding the system of care values and principles and the work that you're doing. Secondly, to establish a social marketing communications committee. This committee will include your partners, family leaders, families and youth receiving services, really every aspect of course, your evaluator and others. From this committee, you need to develop a social marketing plan, which is part of your effort for your overall strategic plan for the system of care. Again, that shouldn't be one person or one contractor writing a plan. It should come from the group. It should be approved by your collaborative governance body. And it should be a living document that changes as you go through the life of your cooperative agreement. Next slide, please. Beth, who is here with us today, as well as her colleague Bob Freeman, have demonstrated in their research on what works in terms of sustaining system of care approaches that social marketing is an important part of the mix. In terms of expansion, it can help to have the community and community members to develop understanding and ownership of system of care principles and values. And that means families, youth, partners, all not just buying in, but owning system of care values and principles. In terms of sustainability, through social marketing strategies, you can develop strong partnerships, get buy-in for your work, and really integrate in the system of care approach into your community, state, tribe, territory, long term. So what social marketing can help you with is to develop communication strategies to really do the work that you're trying to do, which is expand and sustain the system of care approach. Next slide, please. You can use social marketing strategies several ways to do this. First of all, I think you're aware that it can build awareness, increase understanding of the importance of children's mental health, promote an understanding of system of care. Because social marketing is audience-driven, unlike public relations or traditional communications, the audience drives everything you do in social marketing. Well, because the audience is driving it, you can hear family and youth voice as part of it, partners' voice. There is buy-in and support because they own it from the beginning. Part of social marketing is developing strong partnerships with system of care leaders, with youth-serving and family-serving agencies, family organizations, and many others. And finally, social marketing can help with actual policy changes because you are really promoting a new way to do business. And all of the activities that you do in using your data, in using personal stories from people with lived experience, from developing partnerships, all can help to change policy in your environment. So therefore, social marketing is not like developing a cool brochure or a poster. It's really about the fundamental work that needs to go into expansion and sustainability. I'm now going to turn it over to Kristen. Kristen, are you there?
Yeah, thank you, Lisa. And good afternoon to all of our participants today. This next portion of the webinar is going to focus on a general view of the social marketing planning process. On the slide, you'll see a graphic representation of how a plan should flow, starting with the goal at the top. Awareness Day is a great opportunity to delve into social marketing planning, and we will be discussing where your Awareness Day events and activities fit within the planning wheel. And just as a side note, remember that we also have sample plans and more planning resources that are available for download in the bottom right corner of your screen. Before we talk more in depth about planning, we'd like to hear from you as our audience today. If you can locate the chat feature that's in the bottom right corner of your screen, we'd like for you to let us know briefly what you're going to be doing for Awareness Day. So let's take a few minutes and see if we can get some volunteers to let us know what they are planning. And of course, we want to hear about everything. There's no too big or too small as far as Awareness Day events or activities are concerned. We love to hear them all, and we want you to share them with the other systems of care that are on the line. So we've got Anne says that we're going to have some outreach events and a Zumba dance. And yes, the PowerPoint will be available. Tabitha, we've got a block party being planned, and I think that's Missouri. Melissa, we're meeting with our joint team to discuss possible activities, so they're in the planning stage. We've got a butterfly release activity across Texas. Such a variety of things. Traveling photo voice project. Move It Forward campaign with Youth Move. Resiliency ring of advocates that will circle Ohio's State House. And then some people that are possibly going to attend the national event, which is something we're going to be talking about today. There's some green ribbons, of course, a great activity for Awareness Day. These are all wonderful examples, and you can continue to put those in the chat box, and we're going to go ahead and move on with the webinar, but thank you so much for sharing, and we appreciate that. So based on all the responses that we just got, it's clear to see that we all understand how beneficial it can be to incorporate Awareness Day into your social marketing planning and strategic communication. You can see here on the slide just some of the benefits of Awareness Day participation for some of the new system of care communities. And we've seen lots of participants use Awareness Day as a public introduction for the work that they intend to do throughout the cooperative agreement and beyond. System of care communities who have participated for a number of years with Awareness Day events usually begin to focus specifically on particular audiences and messages that will help with expansion and sustainability. No matter where your community fits regarding Awareness Day participation, the benefits continue to grow each year. Planning for Awareness Day can at first glance seem like a hands-on experience where you're working toward a final product, like an event or an activity or even print media. You know, the fun stuff that your community gets to actually see. But if you look at the planning wheel, activities, events, and materials is basically halfway around the planning wheel. That's where Awareness Day fits, but you can't start there. Because there is so much preparation needed to create a great Awareness Day, it's easy to want to jump in and start there, but experienced social marketers will tell you that your event will be much more successful and guide you more toward expansion and sustainability if you start planning for Awareness Day at the top of the wheel with your overall goal. So let's start there. There are a few common goals that we see from participating systems of care. Whether the goal is buy-in or support or raising awareness of the availability of services, it's easy to see how Awareness Day can help promote these goals. Even though Awareness Day only happens once a year, your goals, audience, and core messages will stay the same throughout the year. From your established goal, we move around the planning wheel to focus on the main audience. With your goal in mind, what audience is intended as the primary focus? From the common goals listed in the last slide, for example, raising awareness of the availability of services, it should be clear who the audience or audiences are that fit with that goal. The next step on our planning wheel is determined based on your audience focus. What messages for this audience will help to achieve your overall goal? On this slide, you can see some specific examples of the goal, audience, message, progression. Your system of care may be focusing on increasing the acceptance of systems of care and may want to focus specifically on reaching educators. Using a sample message of children receiving services and supports from systems of care are less likely to be absent from school and have better academic outcomes would be an effective message and approach. Each message must highlight the benefit to the intended audience. They must be tailored for each. You can see that both audiences listed on the slide have the same goal, but each need a specific message that speaks to them. And another example of tailored messages, this one focusing on an audience of policy or decision makers, carries a message that promotes educating the audience with specific evidence-based outcomes. This message works for this audience, but would not be as effective if applied to the previously discussed audience example. And as we move along around our wheel, after you have identified your goal, your specific audience, and your effective message, you must determine the best channel to share the message with your intended audience. There are a few channel options listed on the slide, but over the years we've seen many different channels used as systems of care understand the unique ways their audiences receive information best. Consulting with the various members of your social marketing committee can also help you identify the most appropriate channel. So at this point, we've determined our goal, we've chosen our audience, we've written an effective message, and we've chosen a channel for distribution. And now we look toward developing a product based on those ideas. Your Awareness Day event fits into your strategic communications plan here at this point. Your event will require specific planning of its own to be successful, but this is where it belongs within your communication plan. In the second half of our webinar today, we'll be talking about specific types of events that communities have done for Awareness Day so that you can see some examples. So we are nearing the last two steps of our planning wheel. The first of these last two steps is the pre-testing and implementation stage. Before you implement, test your messages and materials through a sample audience. Pre-testing does not have to be formal or complicated. It's just in place to assure the effectiveness of what you have planned. And finally, the last stage, evaluation and mid-course correction. How are you going to know if your plan is successful in meeting your intended goal? The way that that's going to happen is because evaluation begins with your goals. You must establish some measurable objectives. For example, on the next slide, we have examples of process measures and outcome measures that can be used. Your Awareness Day events are often an investment of time and resources for your system of care. Take the time to make sure you have a way to determine the impact of your Awareness Day event. Awareness Day, again, is a great opportunity for social marketing, and coming up next, we'll take a look at how communities across the nation are celebrating. As a quick recap to the planning process, we want to make sure that you know about the resources available to you. So not only will you have access to the planning wheel that I've just discussed and talked about the steps, but also included is the social marketing communications plan template so that you'll be able to download that and begin a shorter version of your planning. There are a few other social marketing TA resources that we have for you. We have information on our listserv that we hope you will subscribe to so that you can be updated on the activities of the Caring for Every Child's Mental Health campaign. This year, we will also be offering a Social Marketing Matters email bulletin that can provide you with timely updates, advice, and examples of successful social marketing. We encourage you to take a look at the Excellence in Community Communications and Outreach, or ECHO program, for ideas of what other communities have done and been recognized for with their outstanding work. We hope that you will participate in the future. We also hope that you will take advantage of the Knowledge Network for Systems of Care Television, or KSOC TV, by viewing past episodes and joining us for future episodes as well that cover topics relevant to your social marketing efforts. Awareness Day planning materials, tip sheets, and other resources are also available through your social marketing TA provider. We hope that you will avail yourself of all of these, and we look forward to your success in the work that you're doing and understanding how social marketing is going to support that work. And now as we move on to the next portion, I'd like to introduce Shannon Walsh, who will give an overview about Awareness Day.
Thank you, Kristen. So we're going to talk about what Awareness Day is and how it all began. So like all good social marketing activities, National Children's Mental Health Awareness Day grew out of a request from our audience, which happens to be you, our system of care grantees. It actually began from the Oklahoma System of Care when they wanted to celebrate their partnership. Then other sites started to begin asking for technical assistance to do things on the same day. And several years later, it has turned into a national event that takes place every year in May. Since then, we've had national leaders in the mental health field as well as celebrities as our honorary chairperson, which have included in the past Jamie Lee Curtis, Cyndi Lauper, Howie Mandel, and Demi Lovato, among just a few. The goal of National Children's Mental Health Awareness Day is to create a national spotlight on the importance of children's mental health and reinforce that positive mental health is essential to a child's healthy development. It looks at integrating national and local efforts to amplify the impact and galvanize communities from all across the country. So we're going to ask another quick chat response. So please take a moment to type into the chat box, what is the most interesting thing you have seen from your communities for Awareness Day? There's a response that has come in that says, people asking what the green ribbon stands for. Looks like we have a few other attendees that are typing now. There's another response that says, watching the interaction between some of the older kids in residence programs who are helping at the Rita's events engage with families. Another response says, people asking us to give them more mental health information to pass out at their organizations, and some have signed up their staff for mental health first aid, which is great. Let's see. Hearing youth and family stories. Yes, that's so important. Let's see if we can get maybe just one more. Events where families and youth are both engaged in meaningful activities. Wonderful. So it looks like our participants have seen some really exciting things happen for Awareness Day. So Awareness Day activities happen in communities all across the nation. And you'll see on the slide there are several community activities that have ranged from Michigan to Florida to Texas. Some examples include the Up to You Mental Health Festival, which created a YouTube video that highlights their Awareness Day activities, from games to prizes, resources, booths, and fun days for families and youth to engage, while also raising awareness about behavioral health and mental health disorders. From Broward County, Florida, they put together a Mental Health Awareness Month celebration, and they looked at participating activities from a proclamation as well as a cross-system training for frontline staff and providers, a Children's Mental Health Awareness Day event with various forms of art and other activities that include an art exhibit called Inside Out, Art as Healing Therapy. And in Texas, we have also heard from our system of care put together hosting a Stand Up and Soar, which for Children's Mental Health Awareness Day event encouraged partners, families, and youth to come together to fight misperceptions and celebrate strengths. The event included cultural diverse speakers at the State Capitol building, a 1-mile walk to a nearby park, and a festival with superheroes, youth performers, snow cones, and many other fun activities. So these are just a few examples of Awareness Day activities that happen all throughout the country and really help to amplify the exciting and meaningful work that you all are doing within communities. It's particular to note that on SAMHSA's website, there are several resources and tools that can help with Awareness Day planning. So if you go to samhsa.gov/children, you will see that there's a whole list of Awareness Day resources. And you can click on the resources and it will list out templates and how-to guides that include an event checklist, as well as a media outreach tool, partner outreach, social media engagement and examples, and several other helpful resources that can really help with your Awareness Day planning and give some really helpful tools to start your Awareness Day planning now and all throughout the year. So I encourage you to go to samhsa.gov/children and check out the Awareness Day resources. Now I'm actually going to pass the webinar on to Tina Oral, who is going to be our community speaker and is going to talk about the exciting work that she is doing in her community around Up to You Mental Health Festival.
Thank you. As you noted before, I think it's really easy to just say, hey, we would love to do this cool event, and in our case, we could have said, hey, we just want to do a carnival for the community. It seems like it would be fun. And that is so easy to do sometimes, but I appreciate that graphic that you showed earlier that suggests it really does work better when you start with your goal. And for us, we kind of took it back to the beginning and went back to our original goals, which were to reduce mental health discrimination, increase awareness of mental health disorders, and then increase awareness of when and where to seek help. We also really had to look at our audience. Again, I think it's so easy to think, well, this is a great message and we just want to give it to everybody. But I've learned over time that we have to be strategic about when and where and how we do that, and part of that is really pinpointing your target audience and deciding who that's going to be for whichever event that you're working on. For us, we wanted this particular, we had these goals in mind, and we wanted to reach our community, so just the general public, people who were being affected by services or were experiencing barriers to mental health, the ones who were experiencing the stigma, those are the people that we first wanted to reach. And the messages that we wanted to bring, first and foremost, we wanted people to know that there's hope and there's help and there's healing when it comes to mental health. We also wanted people to know that they're not alone. We've heard that a lot from parents and youth, that it's such an isolating feeling dealing with mental illnesses. And the irony is that you talk individually to them, they all feel that way, and yet collectively they're not alone. They all experience some similar issues. And so that was definitely something we wanted to convey to them. And then we wanted to let them know that there are services and supports that are available. In our county, we have lots and lots of resources, but sometimes helping people connect to them or understand which ones would be relevant for them, that sometimes can be a challenge. So we wanted to shed some light on which services and supports would be available to them. Next, we had to focus on our channels, what we were going to use to communicate these messages to our audience. For us, we decided that it was important to use local channels, those that were easily accessible, and we chose a location that was right in the heart of where a lot of our families live and are familiar with, and that was a local mall. We rented out the mall space and took over the mall for this event, which was fantastic. We also then, of course, got some additional bonuses of people just walking into the mall and discovering there was a huge festival going on. So a lot of them just joined in at that point. So that was just kind of a bonus. But we did choose that mall because it was in an economically challenged area. The mall itself had kind of been struggling, so it was also helpful to them for this many people to come in. But it gave us a great space to work within, and then in there, within that space, we were able to bring in local performers. We invited our media, radio stations, and print media to come in and do stories and have booths and roam around and interview people. We certainly utilized Facebook, and then we had some representatives from helping organizations who helped to carry some of this message. And then we also just used a lot of everyday people from our community. As we planned the event, it was so refreshing to hear people come forward and say, you know, my cousin struggled with a mental illness, and community mental health was so helpful in connecting them to the resources they needed. Or sometimes they would even say, you know, I struggled with an issue, or I had an issue accessing a service, and then they would tell their story. And it was so refreshing for people to come together and share some of their own personal experiences as we planned it. So those made for excellent and easy channels to use. I guess my one tidbit about that would just be, I'll go back to that slide, you don't have to utilize channels. You don't have to spend a lot of money. You don't have to utilize channels that are national. A lot of times if you just look around you, there are channels to be used right there in your own community that you may not know about. So look around you and try to partner with some of those as well. That worked really well for us. And so the activity itself, it was a mental health festival, just as it sounds. We've had over 7,500 people over 5 years attend it. We included carnival games and activities, resource booths, different materials, arts and crafts. Everything had the same goal, and that was to bring people back to the resources that are in our own community, and to bring them back and connect them to those resources, but also to reduce stigma, to get people to feel like they're not alone. There are other people that may be having similar challenges. And so we also wanted to make sure that we could include some pre-testing and mid-course corrections, as you talked about previously. I have lost my slides, just FYI, but I'll just keep talking. Thank you. They're back up. We did that by getting some input from parents, youth, and community partners. We really try to talk with them about, what do you want this event to be? What would speak to our community? Pairing mental health with a carnival doesn't always seem like a likely pairing. People, they don't always want to talk about mental health or think about it as a fun and jovial event. But we really tried to make it an event that would allow people to feel at ease discussing real-life issues. And I think that we were able to do that because we involved the feedback of those that we were working with along the way. And some of the things, by the way, that they told us were to make a couple of just real-life examples. A couple of people noted that because the mall is so big and so noisy and so many people, it would be really helpful to have an area where kids who are have sensory issues could calm down. So we did do that. We built in one section of the mall that was much more quiet, where there was just some space for them to do some creative activities at tables. That area was less populated, etc. So there were times when, it was really concrete. People gave us some great feedback that maybe we hadn't thought of, and we made sure to try to incorporate that as we went. There was an evaluation. We had a team come out, and they did surveys. They did surveys when people entered, and then they did surveys when people exited the mall. And about 1,500 attendees were approached with the survey, and they were able to give us information when they left that was really, really relevant. We saw about a 10% increase in knowledge about services, which was great. I think that next time, one of the things we'd want to do is always increase participation. We did have an incentive. They were able to be entered into a drawing to win a prize. But I think, I guess my piece of advice would be to get relevant feedback, sometimes you need more than just one incentive or even one message. So I think that we would really, if we were to do it again, we would maybe have additional methods, maybe also some live interviews, people roaming and maybe collecting information that way, and maybe giving people several different outlets for sharing feedback rather than just one or two. With that amount of people, it seemed like we might get even better results if we were to diversify the methods a little bit. So one of the things that that we learned is that the carnival was really great. It was a one-time event that lasted one day. And it was big in that we reached a lot of people all at once. But it also was, we felt like, but then it kind of tapered off when it's done. We felt like our ability to continue to reach those people was a little bit lessened. And so one of the things that we talked about was how can we take this concept and turn it into something that's that reaches further and that is consistently in front of people all year long. And so one of the things that we did for our mid-year correction or mid-course correction is that we actually have taken the Up to You Mental Health Festival and turned it into the Up to You Mental Health campaign. This allows us to continue to address our goals while providing new and exciting opportunities for our community and beyond. Because the campaign is web-based, we can also reach a national and possibly a worldwide audience. We retain the same goals, the same target audience, the same message, but we get to incorporate some new channels and activities, which is really exciting too. And I think that that highlights the Up to You Mental Health Festival. I appreciate, again, being able to participate.
And thank you so much, Tina, for that really comprehensive and exciting accounting of your events. I think it really shows all the steps on the marketing wheel. And now what I'd like to do is transition from the community-based focus to the national level focus. And the reason we even started creating national events was because the System of Care community several years ago requested that we develop activities on the national level which could amplify your messages. So that's what I love about Awareness Day, is that it really is grassroots, as Shannon had explained previously. Thank you to all of the sites who were active last year for Awareness Day. We had some amazing results. We had over 1,100 communities, states, tribes, and territories participating. Over 127 million media impressions. That includes all kinds of social and traditional media on the national, local, and state levels. Over 150 national organizations and federal programs participated. And for the Washington, D.C. national event, so far we've had 2,200 people watch the event either live in the audience, on the webcast, or on our on-demand webcast, which is still available at samhsa.gov/children if you'd like to see it. Now I'd like to tell you a little bit about plans for this year, Awareness Day 2017. As we've talked about, we need to start with the goal. The goal for the national event is to increase understanding of the importance of the connection between physical health and behavioral, meaning substance use and mental health. Looking at the whole child, the whole youth, the whole young adult. Awareness Day this year is going to be on Thursday, May 4th. The national event will take place at 7 p.m. Eastern Time at the Jack Morton Auditorium, which is at George Washington University. And that's a really exciting venue. We used it last year. It's really good for multimedia. The theme this year will be Partnering for Help and Hope. Partnering for Help and Hope represents the fact that we're looking at integrated care through partnerships with primary care, behavioral health, and others, families and youth. And I also want to mention that the structure of the national event was a result of a mid-course correction. We heard last year from you that it was great that we're doing the national event for a number of years, and it's gotten to the point where there was a little bit of a disconnect between the local, state, tribal, and territorial levels, and the national level. And so we created for the first time, with your help, an interactive event where families and youth could call, tweet, or email questions to the panels on stage and get their answers in real time. And we received a lot of good feedback on that. So for that reason, we're going to continue that strategy this year. So that's a great example of learning from your mid-course corrections. In terms of audiences this year for our message of the importance of integrated care, we've got a number of audiences. Primary health care providers, which includes the whole spectrum, not just pediatricians, public health providers, school nurses, family physicians, nurse practitioners, and others. Behavioral health care providers, including social workers, child psychiatrists, child psychologists, counselors, therapists, and others. Family organizations, youth organizations, and families and youth receiving services, or those in need of services and supports. And in terms of messages this year, we are working directly with representatives of each of these audiences to craft the language and the tone that works with those audiences so that the messages really are audience-driven. We have some broad messages. First of all, one of SAMHSA's big messages all the time, which is that mental health is part of overall health. Fully integrated care works. Youth deserve comprehensive care that addresses both their behavioral and physical needs, and families deserve a team of providers to work together. Now, each of these general messages are really being refined. In this case, for families and youth, the family and youth leadership organizations are helping us craft language that really, hopefully, will resonate nationally and in communities. Next slide, please. In terms of channels, we have over 150 federal programs and national organizations. This year, we've really been working to bring in new primary care providers, including the American Academy of Family Physicians, which is a huge addition. The American Academy of Pediatrics will be playing a much larger role this year. Pediatric nurse practitioners. ASTHO, A-S-T-H-O, which is the public health, it's kind of the equivalent to the NASHPD, the National Association of State Mental Health Program Directors, and they work on the state level on public health issues, and others. So we're hoping that with all of these organizations, and you see some of their logos here on the slide, that you will really reach out to the affiliates and local chapters that you can work with in your communities. In addition, we have our wonderful media partner, NBC4, that live streamed the national event last year, along with 10 of their sister stations who are major media markets across the country. And we're hoping to engage NBC Universal as well this year in our efforts. Next slide, please. We will have new national data to release as we do every year. This year, the data is going to be coming from SAMHSA, from our National Household Survey. And I think it'll be very exciting data showing that there is an association between depression and several major chronic conditions. And you will have an opportunity to be on the webinar a couple weeks before Awareness Day to learn about this data and how you might use it to promote and sustain your efforts in the local and state and territorial and tribal levels. We will have 3 different kinds of products that include the data that you can use. We will have what are called spotlights, which are one-pagers that have like a paragraph of text and then a graphic. And those are good for the media and for the general public. We will create infographics showing the association between depression and several different conditions, which are great for both digital and print media. And then we're also going to have something a little more detailed and technical called a chart book, which you can share with medical and science writers and health providers in case they want to delve more into the data. So we'll make these available for you on Awareness Day to share with your partners at the local level. Next slide. As you do, we like to involve art in the activities on the national level, and this year we have a very exciting activity that's being led by Office of Head Start, American Art Therapy Association, and Youth Move. They are going to involve their local level folks in working with young children, adolescents, and young adults in creating art that expresses the theme, I am a work of art. I am a work of art really demonstrates the concept of a holistic view of the health of our children, youth, and young adults. And so they will be working with them to create this art, which will be uploaded and sent to the American Art Therapy Association. The American Art Therapy Association will create a huge digital exhibit which will show the development from young children all the way up to young adults. And this National Digital Art Collection will be available for you to see online, for you to take pieces of it and use in your social media leading up to Awareness Day. And then at the national event, we'll also be showing some hard copy versions of this art. So that's an exciting way. It may also stimulate people in your community to want to upload their own art that expresses, I am a work of art. Next slide. So how can you get involved in terms of national activities for Awareness Day? As last year we did, we're going to encourage you to hold Awareness Day live activities if that works for your community. What that means is watching the live webcast. You can host a group of people to watch the event together. You might want to add a local speaker or have discussion afterwards. If the timing of the national event doesn't work for your community, 1 week after National Children's Mental Health Awareness Day, we'll have an on-demand version available. We also, a while after that, will be breaking down the national event webisode into small mini webisodes so that you can use them in your technical assistance and training activities throughout the year. You can share details about your Awareness Day activities through social media. You can help us promote the national event through your communication channels. And we will be co-sponsoring a Text Talk Act activity again this year with Creating Community Solutions. And that will be involving youth and young adults who will use mobile phones to talk about mental health, and in this case, the importance of integrated care. So lots to do on the local, state, national levels. And again, I want to thank you for all the great work that you're doing. I know on behalf of all the project officers, we so appreciate your work every day. And we love the opportunity to be able to promote what you're doing. So now I'd like to turn it over to Shannon. Shannon?
Thank you, Lisa. So now we're actually going to open it up to any questions that you all may have, feedback or thoughts. So if you'd like to go ahead and type into the chat feature any questions that you have around Awareness Day planning, or if you'd like to hear more about other sites, community activities, the national event, and really just share some of your insights about things that have worked in the past around Awareness Day. We really want to be able to spend just a little bit of time to answer those questions. So it looks like there was a question that says, let's see, the tagline is Partnering for Health and Hope for Awareness Day 2017. And there was a comment actually that says it would be extremely helpful if the data was available more than 2 weeks in advance. So Lisa, do you want to just briefly answer that about, I think we're working on trying to get that.
Sure, be happy to. Traditionally, up until this year, the data's only been available a week before. I did talk with folks at SAMHSA, and we negotiated that we could do it a couple weeks before to help you. We can't do it way before, number one, because the data is getting cleared and all the materials are getting finalized. But we can, we can negotiate how far. I'd say at least a couple weeks. Maybe it'll be a little more. And I know that it takes time to integrate it. So we're doing the best we can in terms of sharing the data with you as soon as possible. But we could do 2.5 weeks, 3 weeks, so we'll look at that. Thank you. I'm glad you're interested in it.
Thank you, Lisa. So I do also want to point out that tagline is partnering for help and hope, not health and hope. So health, H-E-L-P, and hope for Awareness Day 2017. There is another question from Teresa that says, is there more information about the art exhibit and how children and youth can submit artwork? So I can go ahead and speak a little bit to that. And then if Lisa, you'd like to add anything, then that would be great. So the art exhibit is actually a national collaborating organization-led initiative. So for National Children's Mental Health Awareness Day, there are organizations that collaborate with SAMHSA for the national event, and these include organizations like Lisa had mentioned that are primary care as well as behavior health. So you've got the American Psychological Association, National Council, so there's a variety of different organizations, and the art exhibit is going to be led by ADA, which is the American Art Therapy Association, as well as the Office of Head Start and Youth Move National. And so it's going to be driven by our partner organizations, and so they're going to be the ones who are collecting the artwork from their sites, and they're going to be working specifically with a licensed art therapist. And so
right.
The art won't be collected from System of Care grantees. It will be created in the classroom setting with an art therapist sort of advising the work with the children and youth, and going through the formal setting of art therapy and the outcomes that have been associated with that around expression and just really the benefits that have come from art therapy. So that'll take place in the art in the classroom with the art therapist. So we won't be collecting artwork from System of Care grantees, but there is an opportunity to share the exhibit once it's complete through social media and do a lot of promotion to get excited leading up to Awareness Day, or if there's opportunities within your own community initiatives around Awareness Day to use the complete digital art display. There's opportunity with that as well. So Lisa, do you have anything to add?
Thanks, Shannon. I mean, one idea is if you really do want to submit some, contact your local Youth Move chapter and see if you want to collaborate with them. The art therapist effort is specifically, as Shannon said, the clients that are working with the art therapists. However, you can definitely reach out to Youth Move, and as Shannon mentioned, you can also, if you're going to use pieces of the National Digital Art Collection in your social media, you might want to also add some art from your community at that time. So there are a few ways to get involved with it. And I think, does that answer your question? Pretty well, hopefully.
Okay, great. I also see a question come in about the YouTube video that was mentioned earlier. So Tina from Kent County, who is our community presenter, did say that the YouTube video is of their community festival, the Up to You Mental Health Festival that took place in Michigan. And so we can go ahead and post that link either into the chat box. I might have Carolyn reference that, or Tina, and we can make that available if you'd like to go and check out their video that took place from their Awareness Day activities. Oh, perfect. Tina already typed it in, so great. And she also is making her contact information available as well if you have any other questions about the Awareness Day activities that are taking place in Kent County, as well as her email address. Okay. I don't see any other questions typed in the comment box, but we do have a couple other questions from our team for Awareness Day that we think would be helpful to discuss in terms of what materials would be beneficial to you all for Awareness Day planning. I know that we had mentioned some of the materials on SAMHSA's web page, but if there's anything specific that we can help as TA providers, please type that into the comment box, and we want to make sure that specifically from our system of care communities if there's anything that would be beneficial. And Beth also asked a question about, do any of you have examples of how community activities were aligned with and part of a coordinated statewide effort? Which is a great question. So if any of our participants have worked with aligning their community activities with coordinated statewide efforts, please let us know by typing in the chat box. Okay. I think another great question, while we just have a couple more minutes, or a point of discussion would be if any of you have used the mini webisodes for Awareness Day, so we can just explain what that is. So last year we did have, for the on-demand version for the national event, we created mini webisodes that broke down into different content areas. So there was one on education, one on juvenile justice, and there were some helpful resources that aligned with those videos that you could use within your communities. And so some discussion questions that go along with those mini webisodes, which are great resources, are also posted on SAMHSA's webpage. So I encourage you all to reference that. And that can help with your community activities all throughout the year. So that's not something that just needs to happen in the month of May, but as you are implementing your Awareness Day activities all throughout the year, those mini webisodes are very helpful for that. So a couple questions are coming in, a couple responses. Last year, in Michigan, they worked on a Youth Move statewide initiative with Youth Move to go to the Capitol and address legislative concerns for mental health issues. So that's a great example of how community levels were aligned with the statewide. Any other materials or tools that might be helpful for Awareness Day that you'd like to see? Looks like we might have a couple. And I also will mention that when we talk about communities, we also do mean statewide initiatives as well as what's happening on the local level. So it's very important to look at what's happening on the state and within the particular communities. Okay. I see looking at social media as a great tool for Awareness Day. On a website development, to look at branding, developing. Another question came in, is the live event going to be tonight again? So yes, it is. It's going to be at 7 p.m. Eastern on Thursday, the 4th. Okay, great. Thank you, Lisa. Let's see if there's any more questions coming in. Looks like we have a couple more. typing. Okay. Looks like we don't have any more questions or comments to share. So I will point out on this next slide that we do have all of the Caring for Every Child's Mental Health Campaign team social marketing TA providers contact information. So if you have any additional questions about Awareness Day, if you'd like more tools or resources or anything else that you may need around your Awareness Day or social marketing planning process, please make sure to reach out to one of your TA providers, and they would be happy to assist in any way that they can and serve as a resource. And then we also have the campaign team listed with NASHBID, Vanguard, and National Federation of Families and Youth Move.
Okay, great. I think we may have another couple of comments coming in. This is Beth. Let's give them a last chance. Okay, their thank yous. So that's great, and I'd like to add my thank you to all of the presenters for an excellent job. I think the information you presented was very practical and hands-on and gave participants some strategies that they can go back into their own states and communities and apply. So I also encourage you to take advantage of the TA that's offered through the campaign. Each grantee site does have an assigned TA provider, and others are also welcome to take advantage of TA for Awareness Day, but also for your strategic communications work that supports and makes the case for system of care expansion throughout your states and communities. I would like again to remind you that you can download materials, including some sample plans that may help you begin thinking about the structure for your communications plan. And put in another plug for the next Learning Community meeting on February 15th at 2:30 on family youth engagement and leadership in your expansion work. And then finally, thanks to all of you for your interest and your active participation, your questions and comments. That's great, and we really encourage that kind of dialogue and find that useful. So we hope that'll be the hallmark of this learning community going forward. And we look forward to seeing all of you next month. Thank you very much.
Beth, it looks like there are two final questions that just came in. Do we want to wait to answer those in the chat, or do we have just a couple more minutes to answer those?
Sure, go right ahead. We do have some more time, so go right ahead and answer them.
Okay, great. So it looks like the first question says, so we can use our own marketing materials, but not the MHA materials. So I might actually direct that question to Lisa again. Do you know about using their own marketing materials?
I'm not quite clear what the question is. Do they mean Mental Health America materials? I'm not sure.
I think we're getting a response, or
clarification.
Yep.
Mental health
The
awareness.
mental health awareness, actually, yeah. So for Awareness Day materials, I believe. So we can use both. We can use the National Children's Mental Health Awareness Day materials that are made available from SAMHSA, as well as state and community materials developed by the system of care.
Sure, if that's the question, definitely. You just don't want to put the SAMHSA logo on your materials because they haven't been cleared through Health and Human Services. But besides that, yeah, definitely use your materials. You can use your partner materials, and you can use the national materials.
This is Beth. About KSOC TV, I'm assuming that everybody gets the TA telegram that is published by the TA network every Monday. And in it, it includes notable news, funding opportunities, but also all technical assistance activities that are available to you through the TA network and its partners. in that TA telegram, there are links and announcements around the KSOC TV webisode. So if you check the TA telegram each week, you should find announcements and links to those.
That's great, Beth. Thank you. And also, this coming up really soon, January 26th at 2 p.m. Eastern Time, we are going to have a wonderful webisode addressing the needs of LGBTQ youth of color and looking at the focus on intersectionality, what it's like to have multiple identities, and how we can best support our children and youth with multiple identities. So please tune in or watch the on-demand a week later.
Okay, and then we're also getting...
see if we, we'll see if we can put the link to subscribe to the TA telegram in for you to see at the end of this, or to send it to you following the webinar.
That'd be terrific.
Okay. And if you're referring to the Awareness Day webisodes, those are available on SAMHSA's website. Those short video webcasts from Awareness Day 2016. So you're welcome to go to SAMHSA's website to check those out or reach out to your TA provider. Information to subscribe to the TA telegram is in the chat box. So make sure that you send an email to that web email address if you are not receiving the TA telegrams. And make sure you put subscribe in the subject line. Okay. That seems to be all the questions we have so far. Any last comments or questions?
Okay.
Okay.
And again, thank you to the presenters and thank you to you as participants for your active participation and your great questions. If you have others afterwards, you do have the contact information for the team for the Caring for Every Child's Mental Health campaign. And thanks to you for being available afterwards to answer additional questions and to work with participants on this. We, again, look forward to seeing you next month on the next Learning Community meeting. And in the following ones, we will be holding this each month on again, a topic that we hope will help you to meet the goals of your expansion work and the requirements of your grant. Have a nice afternoon, everyone.
Thank you.